Ladies and gentlemen, angry Americans around the country and around the world, an early happy Mother's Day. I am so excited to have, I think, the perfect guest for this time in the calendar, this time in our history, and this time in my life, and I hope yours. A very dear and powerful friend of mine, the great and powerful Kristin Rowe-Finkbeiner. Welcome.
Thank you for having me.
Welcome, my friend. It's so good to see you.
You too.
And
happy early Mother's Day to you and everyone.
Happy Mother's Day to you. You are such a force of nature. And ever since I started the show, I've been eager to talk to you. And now is the absolute and total perfect time. But I want to start by asking you, how are you? We're covering leaders in the pandemic. How are you? How are the people you're with? And where are you? And what is it like where you are, my friend?
Well, my answer lately has been medium rare because, you don't just want to say, I'm great. It's not great. Lots of things that are horrible are happening. And so how do you even answer that question? We're hearing from the voices of moms across the country every day about the struggles people are facing with their health, with their economics. Home economics takes on a new meaning right now in their lives with their children. And so it's a time where we're all needing to rise up and have our voices heard no matter where we are. And I'm in Kirkland, Washington, to answer your question.
And for folks who don't know, how far is Kirkland? You can see Seattle outside your window, right? Which was really the front lines for America in this fight against the coronavirus. We talked to Flo Groberg a couple weeks ago. He was in Seattle. Can you paint the picture of what it's like, in your home and in the area around where you are now?
Yeah, I live in Kirkland, Washington, specifically, as I just said, which is about 1.5 miles from where the first fatalities occurred from COVID-19. So we've had in our tiny community here, relatively tiny, there's only a couple grocery stores and a few places to get gas that we're all using, along with the over 150 workers that were working in that facility, more than half of whom tested positive, have had a big hit on our local community in terms of the number of people who have been sick with COVID-19. And so it's been really hard. I will say that our community has taken very seriously the stay-at-home orders. There's been no kind of breakout parties or gatherings that we hear about around the country. We've been hearing that around the country, for the past several weeks, going, what are they doing? When we first heard about COVID-19 here, the fatality rate was so high because epidemiologists had discovered that it had been community spread in our community for more than 7 weeks before the first fatality. And so when we first heard about the fatalities was when we first heard about the disease, the virus at all. And so everybody got scared immediately into their houses. More than a third of our fire department and our police department pretty much got quarantined in that first week in early March too. So it's been real, Paul. It's been real.
I really want to, this is going to be a conversation for any mom, for any future mom, for anybody who's had a mom, like anyone who knows a mom, right? And it really is, I think, an important time to have this conversation with you. But on a personal level, you and I have known each other now for, I feel like almost 2 decades, right? We met through the social entrepreneurship space, and you've been a friend and an ally and an inspiration and a role model in many ways. And to see you and the organization MomsRising that you've created grow in power and dynamism has been just amazing. But you are also one of my favorite people to talk to. You're brilliant, you're interesting, you're dynamic. And I want to ask you the question I ask of all of our guests. Kristen, what is your drink of choice when you are stepping away from being the champion for moms? What is your adult beverage or cocktail of choice?
My adult beverage of choice was brought to me by my grandma, who is 104 years old and smarter than me, and my mom and my aunts. Everybody drinks Manhattans, nothing else. Really? That's the only drink in my family.
Wow. That's a really, really strong answer.
No other choice.
Is there a special family recipe or way that you serve or enjoy your Manhattans?
Every day you're supposed to have one at 5 o'clock. I forget, but my grandma, again, she is 104 and smarter than me, still to this day at 5 p.m. has one every day at 5 o'clock.
Wow. Mm-hmm. That's a fantastic answer. My Aunt Angie is 102, and she's on Facebook, and she's amazing. And I feel like they should get together and have some Manhattans and talk about the secret of life.
Totally. I mean, my grandma is so funny. She gives me so many secrets to life, all of which are useful right now. One of them is always look for the positive and you will be able to find it. The negative is out there, but look for the positive and bring energy that way. But her other favorite piece of advice that I love and I try to take to heart is always try to leave every place you go a little bit better than you found it. And that means you wipe the sink when you're in the public restrooms and you wipe out bad public policy when you're looking at our government. She's funny.
This is, I love how this is starting already. I knew it wouldn't disappoint. So, Kristen, before you started MomsRising, you have 2 kids of your own, and you work nonstop. You become a media force. But when you were growing up back in the day, for folks who are newer to your work and to your life, where did you grow up, and what was your first car?
Oh my goodness. I was born in Chicago. I went to elementary, middle school, and high school just outside of DC on the Maryland side. And my first car was after I graduated from college. That is my dog. Her name is Junie, and she is also a part of the family here. I think there's a bunny in the yard. It's spring.
I love it.
But my first car was a Datsun, and it was a great car. I had to start it with a screwdriver because it was not very new, this car. And so I also didn't have a ton of money, so I spent a lot of time in the junkyards getting car parts for my Datsun as it fell apart. And so I learned a lot about cars with my first car, and that was kind of fun because now modern cars, you can't do that anymore.
100%. That's amazing. Do you know what year it was and what color it was, Kristen?
It was kind of like a maroony, dirty color, and I have no idea what year it was except old. It was used when I got it. Well used. So yeah, I love that car though.
I love it. I love it.
Fix the car that you're friends with. You know, the car will only stay fixed. If you don't know what you're doing when you're fixing a car, unless you're friends with the car, it will not work. So we were friends because it actually allowed me to fix it, is all I'm saying. It drove after I, put parts in it. It's a miracle. It's a miracle.
There's so much insight already. For folks who are listening and not watching, I'm coming to you, recording to you from the second time in what we're calling Studio Delta, and the '69 Camaro SS is behind me. It's orange. It is my new friend. It will become a dear friend, but it still doesn't have a name. So that's open out there on the internet and everywhere else for folks to suggest names. We've heard everything from Orange Crush to Agent Orange, a lot of other ideas coming out. But I have to ask you, because we've heard about your dog, did the car have a name, Kristen?
The car was Bertha. I don't know why. She was a good car.
I'm so glad I asked. Okay, so now that we've got a pretty decent understanding of where you came from, where you are, your dog, your car, your family, getting down to the work that you are better at than anybody I've ever known. You've met with presidents, you've been on Capitol Hill, you've been all over the media, and you are, I think the champion for moms. You've got over 1 million members at MomsRising. So everybody I'm talking to right now is a frontline leader in the fight against the coronavirus. So can you start by setting the stage for us? How is the pandemic hitting moms? And what is the landscape like right now for moms across America, Kristen?
Well, first of all, I want to dive under the table with those compliments. Thank you for them. And it's not me. I work with an amazing team of people at MomsRising, as well as the 1 million members across the country. So I just have to say that because, blushing and freaking out. That was. But what's happening with moms is ridiculous. I mean, moms are everyday superheroes. Clearly, moms are the superheroes in our nation. Moms are on the front lines saving lives in healthcare. Moms are on the front lines lifting our economy. Moms are on the front lines caring for our families. But when you look at what's happening, the impact, we are disproportionately impacted by what's happening with the pandemic. So right now, just take the healthcare field. Now, no, first of all, I love numbers. It's embarrassing. I love numbers. I love stats. But I'll share a couple with you. 86% of women do become moms in the United States of America. So that means it's the majority of women. And when we go back and look at who is in our healthcare force and who's being impacted, 78% of the healthcare workers who have come down with coronavirus are women and moms. It's ridiculous. We need to get people access to personal safety equipment. We need to get people access to sick days, to time off. There's a lot of supports that we need to put into place. Similarly, economics. Moms are the true superheroes in so many ways of our economy. And yet right now we have, even though we have 3/4 of moms are in the labor force and more than 40% of primary breadwinners right now are moms in our country, we look at what's happening with the unemployment insurance and the direct payments, and it's just simply not enough. You know, we've been fighting hard in Congress to get the expansions on the unemployment insurance and the direct payments, and we've made some headway, but we have so much more work to do, and I could talk to you about it for 5 hours about the work to do. I don't want to bore you, but we have lots of demands, and we have really a lot of demands relating to caregiving too. Because right now we have, as everybody listening knows, we've brought all of that teaching, all of those jobs into the house. So the word mom, like I'm sure you've all heard the mom, you know, the 18-syllable word mom, like you hear your kid yelling it for like, I don't know how many syllables get in this one word with 3 letters. You know, there's that many jobs as there are syllables in the word moms. There's like, the 18-syllable word mom has 18 job titles, and one of them is teacher, another is psychologist, another one of them is medical professional. Like all of that has brought in to the home onto moms, and we haven't really changed the structure of support. Or, see, I told you I could go on for a long time. Or the fact that right now, because we haven't invested in our childcare system, about 50% of those childcare centers are in danger of not being able to reopen, so that when parents do go back to work after the stay-at-home work orders are over, there may not be a place for the kids to go so the parents can go to work. So anyway, you asked what's the state of mom, and it really goes back to my beginning answer of medium rare. Like, it is not good out there. There's a lot of work to do. Good news is our voices are powerful. We are making forward momentum. We just need to keep raising them.
I love the stats and I love the analysis because I think it really crystallizes the stakes and the scope. I want to drill down, if we can, Kristen, on one stat that you brought up. So we talked to Tom Colicchio a couple weeks ago, who said he thinks as many as 50% of restaurants may not come back. The childcare piece is I think essential here. And can you shape, you know, what do those childcare centers look like? I mean, are they daycare centers? Are they mom and pops? Are they industries? You know, when you say 50%, that's devastating. And I don't think most folks listening were probably tracking on that until they heard you say that. So can you drill down on that a little bit? And then what do you see as a long-term impact to families, moms and kids and everyone else because of that? I mean, do we need a bailout for childcare centers? And if that doesn't come, what happens next?
Well, first, we absolutely need a bailout for childcare centers, and it is not a small price tag. It is actually $50 billion with a B dollars needs to be put into our childcare infrastructure immediately in order to stop the loss of those 50% of all existing childcare centers. So everybody's listening. It wouldn't be me if I didn't do a call for action. Yeah. Please call your member of Congress and ask them to put funding for childcare into the next congressional relief package. So what's happening? What size childcare center is at risk? The sad answer is all sizes. I mean, going into this pandemic, we had a situation that was a rolling emergency across the United States of America in relation to childcare facilities, where parents can't afford to pay any more. Childcare already costs more than college in most states. We can't pay childcare workers any less. Childcare workers are already among the lowest paid workers in our nation. And so we have already parents on the line and the childcare centers on the line in terms of just barely making ends meet, which is why this pandemic has tipped so many over. So it's tipped over the edge the big childcare centers. I've done interviews and heard stories from the big childcare centers who are just barely making ends meet coming into the pandemic. Similar, the smaller childcare centers, they're unable to continue paying their employees while there are stay-at-home orders in effect. And so those centers and the mom and pop ones are also on the line. So one of the parts that we need in the bailout is actually to keep paying the workers, even while we are not having children in those workplaces. Because the other thing where it's tied into all of this, because it's all tied in together, is that, you know, the primary folks, the majority of folks who are essential workers are women and moms right now, just in a pure numbers state. So what happens when essential workers don't have a childcare facility for their kids to go to while they do that essential work? Absolute mayhem. So we need investments now and in the future.
You have been great at being an advocate and raising public awareness, but also getting things done. You know, when I was at IAVA, you guys were on a parallel track, passing bills, moving legislation at the state level and at the national level. But we're in a, you know, not just a healthcare new normal, but a political new normal with Trump in the White House. And, you know, we've got Mike Pence as VP. Now we've got Joe Biden. We will not have a mom as the next president of the United States, barring some kind of, you know, change of events that's catastrophic. We may have a mom as the VP nominee. Can you talk about the political landscape specifically under Trump and how that has impacted moms and what you would like to see going forward? And frankly, how important is it to you that Biden picks someone who's a mom?
Yeah, that's a hard question. You asked about 500 hard questions in a row.
Yeah.
First of all, have any of you ever been, or have you been at the dinner table and like you were not wanting to eat your green beans or your Brussels sprouts or something like that, and you pushed them to the side of the plate or try to put them in your napkin and your mom noticed?
Yeah. Yes, many times, often. Yes.
So Donald Trump is sort of like that. He's like the toddler who is, you know, trying to push the green beans or the Brussels sprouts or something, trying to hide what's really going on from moms. But moms know better, right? Moms know when toddlers have a tantrum. Moms know when somebody's trying to get away with something or is fibbing. Unfortunately, Donald Trump's fibs have life-losing consequences. And so we're seeing increasing concern, increasing frustration, increasing anger from moms in every state in the nation across all kinds of political stripes about what is actually happening, particularly in this pandemic when the mistruths, to put it nicely, are so obvious. You know, I mean, it's so ridiculous. So, you know, what Donald Trump is doing right now is clearly a violation of the mom policy. so that's happening. Yeah. And what does that mean? That means that moms are thinking about voting in more active ways, already thinking about voting. It means that our volunteers are up, our engagement is up at MomsRising. We're seeing Moms Rising across the country, unlike ever before. People are paying attention more closely to the election. They're concerned. Is there going to be an election? Is there going to be attempts at a delay of the election? And moms are there to say, no way, no how. We're not going to let a delay happen in this next national election in November. We're going to cast our ballots, and we're going to do it because we're in this together for the future of our nation.
Yeah. When I think about the historic landscape, you know, my focus has obviously been on veterans, and it's been, you know, a long time since we've had a veteran in the White House. But there's never been a mom in the White House, right? As a president, right? Like you've had Michelle Obama, who you work closely with, was such a powerful force. But it's really shocking to think about the fact that we've never had a mom as president or vice president, right? Maybe the closest we got was Hillary Clinton or Geraldine Ferraro, right? That were a step away. But when you look to the VP candidates, you know, it's now widely reported Biden's going to pick a woman, right? He said he's going to pick a woman. So it could be somebody like Amy Klobuchar. It could be Kamala Harris. It could be Elizabeth Warren. Does Moms Rising, or do you have a favorite among them that you think will best represent your community?
We don't have a stated favorite, but I want to touch on the mom leadership point. And that's an important one. There's been an analysis of the response of world leaders to the pandemic. And unsurprisingly, that analysis has found that countries that have a mom as their national leader are doing better. That is all I have to say.
Yeah. Yeah.
We need more moms in leadership. Moms save lives, they save the economy, and they make you eat your Brussels sprouts so you live longer.
I appreciate all of that answer, okay, especially the diplomacy of it. When we look at the landscape, this is angry Americans, right? And we say all the time, if you're not angry, you're not paying attention. I think moms have plenty of reason to be righteously angry, and they often work with you about turning that anger into positive impact. And now it's going to be absolutely critical. But there's good reason to be outraged, I think. But when you look at the landscape, Kristen, and you think about the situation for moms or beyond, Kristin Rowe-Finkbeiner, what makes you angry?
Oh, so many things make my hair light on fire and smoke come actually out of my ears on a daily basis. I mean, right now, the fact that Donald Trump is consistently lying to the American public, starting out in early March saying anybody could have a test. And of course, still months later, that is so not true. Starting out talking about supply chains and the parts of the supply chains that the federal government should be supplying to states, and then turning it around and calling the very spectacular governor of Michigan that woman, instead of working with her on actually supplying the real life-saving supplies that the states need and should rightfully depend on from the federal government. Including also that states are having to come together, like Washington, where I am, California, Oregon, and some other states coming together to do the job that the federal government was supposed to do in terms of saving lives. I mean, all of that every day, my hair lights on fire, and it fires me up to keep going.
Can you drill down on from a personal standpoint? You're not just the president. You're also a member. Right. So you are every day raising 2 children of your own and providing the guidance and wisdom and all those pieces of motherhood that are so essential. But do you have any personal insights into how to be a mom, how to survive, how to thrive, however you describe it? Your lessons learned, especially maybe for a new mom who may be facing a pretty daunting environment. What are your lessons learned as a mom that you want to pass on to others, to include dads and anyone else who cares about mom?
I think one of the biggest lessons is that your voice is more powerful than you think in terms of making change. So never give up. Never ever give up. Sometimes things take a long time to change. I know you know that too, Paul. Sometimes policies seem like they take forever, but change is actually possible. So when you're wondering if making that phone call to a member of Congress or, signing on that petition or anything like that is going to make a difference, just know that it will, and take the moment to do it. Now, as a parent, the other thing that we hear a lot from other parents is, Paul, it is now hailing there's a ton of hail outside. So if your listeners hear, I'm going to say they're nickel-sized hail pieces coming down.
Wow. The dog knew. The dog knew. The dog was trying to warn you. Like occasionally during this interview, the dog has been cheering you on. I think other times the dog is trying to let you know, hey, dude, it's hailing outside. This is crazy shit, right?
She's under my chair right now. So your listeners are going to experience Judy the dog and hail noises. I apologize for that.
No, it's all real. We keep it real on this show.
So hopefully we don't get murder bees next, which for those of you who are following the news, the murder hornets or murder bees or whatever, the only place they've been found is in Washington State. So I'm
wait, I gotta pause you there. I haven't seen this. Maybe what the hell are murder bees and murder hornets?
It's super loud here. I'm sure you can hear this. Can you hear it yet?
It's okay. This is real, man. We're getting like a real insight into a really unique moment in history. But what are murder hornets and murder bees?
Murder hornets were in the New York Times this week, so people can check them out. I'm not making it up, but they're these giant hornets that have come in from a different country, and people are very concerned about them because they wipe out our bees that are here in the United States of America, but also apparently they could kill you if they bite you. And so they're big enough that you could tie a streamer to them to track them to their nest, and they will be able to fly into their home, and you can run after them as they're, pulling the streamer behind them. Wow. And so there was this big article in the New York Times, and I of course read it because it had murder hornets. And then I'm reading it, and the fine type, 18 paragraphs in, it's and only found in Washington State, where I am. And I was like, what are you talking about?
guys are having you're having a rough run in Washington, but so that's terrifying. But
Yes.
I wanted to drill down into something else that, on a serious note, is maybe potentially terrifying. I asked you about this as we were getting ready to have this discussion, Kristen, but I think folks sometimes forget, unless you're experiencing it yourself in a time of crisis or anxiety, you can get kind of a tunnel vision. And I think most folks, unless they're experiencing it, haven't thought about what the pandemic is like for people who are pregnant.
Yes.
And I've got some friends who are pregnant right now. They're due soon, or they're due in a little while. Can you shape what that looks like and what folks should know and care about specifically with regard to people who are pregnant right now?
Yeah. Well, this is another area where we just had another win at MomsRising. The CDC was not following the World Health Organization's guidance on how to treat pregnant women, people who are delivering babies, what to do in hospitals. And we're actually, the CDC guidelines did not make it clear that you did not have to separate the mom from the baby. You did not have to presume the mom COVID positive, and also called into question what was going to happen with breastfeeding support. So the World Health Organization guidance
Dog's got your back. The dog's got your back. The dog's basically saying hell yeah or hail yeah every time.
Well, yeah, the dog has my back, and she's like, hello, Mom. There is some weird weather here, which there is, by the way. I mean, seriously, I've never seen hail as big as I've seen during this interview. So, yes, that's happening.
Yeah.
But so what I suggest for pregnant women and women who are going to give birth is to really know your rights. So check out the World Health Organization guidelines for pregnant women and women delivering birth, and know them, bring them to your doctor, because there has been so much confusion because of the CDC putting out confusing guidance. There still is a lot of that confusion out there. So the CDC has updated their guidance, and I want to underscore that for people who are listeners. So you can also tell your doctor the CDC has updated their guidance. So that means that you can have people with you when you give birth. Whereas for a while, we probably all saw in the news that was not necessarily the case.
Mm. That was some of the most powerful, I think, reporting, Kristen, early on when we heard stories of moms giving birth in isolation. There was a big feature piece on CNN of a mom that was in a military hospital in Europe before it kind of swept over here. But I want to ask you to drill down on another piece with your wisdom and perspective. Like right now, the country is reopening in many places, right? And in part, there's some folks who say, oh, it's just affecting the sick, or it's just affecting the old, or it's just affecting a small number of people. But now, there are some cases of symptoms and secondary effects for some children in isolated incidents. Can you talk about your best analysis of how this is impacting children, to include on a mental health basis? But also, we don't know what's going to happen. I mean, and some of this is a leading question, but how different would this be if kids were getting sick, right? I mean, like there's kind of this flippant response because kids haven't gotten sick, but we could be, 1 or 2 days away from a couple kids getting sick, and then everything's upside down. So can you just kind of share your thoughts on that whole perspective?
That's such a big question.
I know. I'm sorry for the magnitude of the question, but you're one of the smartest people I know, and I think you can help pull it apart.
I don't know. I could try. I mean, I think one of the things that we're hearing from scientists, and I think it's important right now to pay close attention to scientists and not politicians. So that's the first little bit of advice relating to children. There's been a lot of hype out there in the news headlines, and we're seeing also heightened coverage of some types of sensationalized ways that people are experiencing illness. And so pay attention to the science, not the sensational headlines, right? Because we don't also want a lot of people getting scared unnecessarily. And so I think it's important for that. For children, and what would happen if children were more impacted, it's just horrifying what's happening to people of all ages. And I think that what we need with children is to have an open dialogue with our kids about what's going on and how we have to each pretend that we have it to protect our communities. Even if we don't have it, we need to still pretend we have it just so that we don't get other people sick. But also, I think really trying to explain to children about why staying home is important, why not being around other kids is important. And all of that are hard conversations we're hearing from our members. It's a hard conversation even with you to think about, like, how long is this going to last is a question that we often get from our kids. And, you know, we don't know the answer. So bringing children on that journey of both being reassuring that we're doing everything we can to protect you. You know, we're going to keep you safe as adults. It's not your job to keep us adults safe. It's our job to keep you safe, and you will be okay for our children is so important. But also making sure that we probably hide some of the news from them.
Yeah, you know, in the last episode, we talked to Anya Kamenetz, and she talked about the impact on schools and kind of thinking about it not as a one-time event, but a new reality where we prepare for snow days. Right. And, you know, when it snows, we don't know if it's going to last for 1 day or for 4 days, and if it's going to be 3 inches or 10 inches. And there's the lack of knowing that I think we prepare for in that way. And I feel like we have to now start to prepare for, not just for this pandemic, but future pandemics. And so when you think about what's next, Kristen, we've had 2 emergency supplementals coming through. You've talked about a third and the need for a focus on childcare areas. Are there other strategic strikes that you need and that you want folks to advocate for, again, not knowing how long this goes on? You're great at prioritizing and then focusing on what's needed most. What are the top priorities that you see for the indefinite future?
We have so many priorities.
Yeah.
We're sending in lists to Congress that are like 4 pages long each week, updated, just in case you're wondering. I mean, the thing is that the contributions and the needs, both of women and families, are so central to the health of the United States of America and often get overlooked. So a couple of top things. One, we talked about, we need to make immediate investments in the child care facilities and structures in the United States of America. So call your members of Congress and ask for that. 2, we passed paid family medical leave and sick days as a first step. It only covers people who work for employers who have less than 500 employees, which is not enough. We've left out tens of millions of people, and it sunsets on an arbitrary date that was based on somebody's idea of when we would maybe get out of this when they passed the legislation, which is you and I were just talking about. We actually don't know when we're getting out of this. So we want those policies to be made to cover everyone and for always, and we want their sunset date, if they have to have one, to be tied to economic indicators, not somebody's random guess. Similarly, for unemployment insurance, we want people to call their members of Congress and tell them to ramp up unemployment insurance further, continue with additional direct payments, and take out the arbitrary ending date, tie it to economic factors. We also really want to make sure that mixed status immigrant families are covered in all of the policies. 25% of the children in America live in mixed status, immigration status families. So what was passed by Congress so far in the first relief packages left out a quarter of American children. A quarter of American children were left out. That's ridiculous. Also, you said, to keep going,
yeah.
We want increased access to nutrition support. So we need SNAP, which is food stamps, increased. We need also the food programs that normally would go through schools increased. We need access to food for families. And we need to make sure that we really look into and move forward decarceration. People who are in incarcerated facilities and jails or prisons, as well as the immigrant detention facilities, don't have the space to be separated by 6 feet or to follow any of the CDC guidelines. So we need to make sure that we address that fact as well. I have a long list. I won't keep going, but those are the top.
It's why, I mean, it's why I respect you. One of the reasons why I respect you so much, because you get shit done. And you get shit done in part because you know what your community needs, and you're a powerful, you know, laser of a voice for them. And even the way you use your language, you say our demands. Right? These are not requests. It's not like we would like. This is a demand. This is what you need or you deserve, even more so, right? So I want to, Kristen, building on that, you're one of the most effective people I know. Anybody who's been listening so far can see, you know, that you're inspiring. You've also been uniquely effective in Washington, in a place where it's hard to get things done. So do you have advice for people on getting shit done in Washington, and then frankly, getting shit done in life? because you seem good at both. And especially now, those are two really challenging environments, Washington and the pandemic. But what are your personal leadership recommendations for just how to be so effective?
Oh my gosh, I'm going to go under the table blushing again, because that is,
Please.
I mean, honestly, the answer is teamwork. It's not about me, it's about we, right? So it's not that I get shit done. I don't get shit done. A lot of people that I work with, that I'm honored to work with, that I'm honored to follow the leadership of, get shit done together. And I think the problem is when we start to think about any single one of us having the weight of the nation on us, or the weight of anything on us, to make those changes. The solution is when we lift each other up as we get things done together. So I've been in the incredible position and humbled to see so much shit get done, because so many people are, exhibiting massively inspiring leadership skills. And so I work on a team of champions. The MomsRising team are incredible superheroes. And I'm just honored to, be able to work with the team of superheroes every day. And for your people who are listening and watching right now, I just want to say one of the things that we hear the most common, and I alluded to this a little bit earlier, is that you're more powerful than you think. And one of the things that we see, particularly in the pandemic experience, magnified, is that people think that they are experiencing something all alone. Like if you can't make rent, or you don't have enough food in your fridge, or, you cannot figure out what happened exactly to your childcare center and how you're going to go back to work because your childcare center just imploded. You are not alone. And what we like to say is that when this many people are having the same problems at the same time, we don't have an epidemic of personal failings, which is how commonly in the United States of America through history, we've sort of talked about the issues relating to work and family as, you're failing to get everything in your calendar, to, juggle all the 18 titles that comes with the word mom when it's said, mom from the park across to your mom. And so you're not alone. And so we say instead what we have of an epidemic of personal failings is a national structure problem that we can solve together, and we will solve together. And so the answer to getting things done is to knowing you're not alone, to finding your team, whoever that is, and to working together. And you'll be so excited that you'll win.
I love it. I love it. I love it. I love it. Your playbook is one that I've leaned on many times over the last, decade and a half that we've known each other. But Kristen, you always also bring tremendous positivity. I think part of why you've been such an effective leader is because you are an inspiration, and you bring an energy that is contagious, and you have a happiness about you. So I want to ask you the other question that we ask of all our guests. Kristin Rowe-Finkbeiner, what makes you happy?
Oh, that is a really good question. A lot of things make me happy, fortunately. My kids make me happy. I love my family. I love being able to do the work that I do. I feel like it truly is an honor to be able to listen to people across the country and help open avenues for people's voices to be heard. I also have been taking online dance classes. I love to climb mountains. I play soccer. And until recently, I was playing soccer for the Violent Femmes. So I got to get some of my aggression out. I have to find ways to get my aggression out in healthy ways, so I can be super positive, hopefully, in person. And the other thing that makes me happy, honestly, is working with that team of superheroes. I look around every day and I'm like, I am so lucky. I work with the smartest people on the planet. So I'm really excited about that too.
Your soccer team is called the Violent Femmes?
Yes.
That's amazing. That's amazing. Well, since it is the month and time of Mother's Day, what are your thoughts on it, Kristen? This Mother's Day in particular, if I view you as like, queen of the moms, right? Or like the ambassador from Planet Mom. I've always felt like the ambassador from Planet Veteran or Planet Military. But if you have a message for the universe on this Mother's Day, what would it be?
That's a hard one, because this again goes back to that question of how are you doing at the beginning, where I was like medium rare. Yeah. My message this Mother's Day is that the cracks in our system that we all knew were there, the cracks in our systems that we knew were letting moms down, that were being the result of which is moms are paid less for the same work, taken off the management track for fewer late days, and just valued less in our country. Those cracks have become the catastrophes that many of us knew all along. So my message is to not just moms, but to everyone who has a belly button, meaning that at some point you've ever had a mom, is that it's time to stand up and to truly value both the paid and the unpaid work of moms, because moms are doing both. If you valued the unpaid work of moms in the labor force, the United Nations says it would be $11 trillion, which is a huge amount. And right now, we're seeing the impact of having moms have to do everything all the time. And it's hard, right? It's really hard. So this Mother's Day, I want people to truly value both the paid and unpaid value of moms and the work that they do. And instead of, or in addition to chocolate and flowers, we'd like you to call your member of Congress and tell them to get moving on a relief package that really values moms and lifts families and our economy along with moms.
I love it. I'm always ready for marching orders, and I think good activists and good advocates give people homework. And every time I have a conversation with you, Kristen, you give people homework, but you're also incredibly selfless, and you give gifts of wisdom and experience and energy. And as a part of this show, I want to close our conversation with a presentation of the gifts as well. We used to do this show in person. We will do that again. I have a gigantic bottle of champagne that we will pop at some point back at the Classic Car Club or another location. So I look forward to you joining us for that, I hope. But in the meantime, I'm going to virtually present you some gifts, if I may. So first, early Mother's Day present. I've got some Angry Americans gear made in the USA coming your way. That I hope you can enjoy. We also have an amazing sponsor for the show, Bravo Sierra, which makes some amazing cleaning products and health products and wellness products, to include deodorant, antibacterial wipes, lots of stuff that will help moms, dads, and everyone in between. And then I have a final question for you that is a tradition on this show. We started around Easter, and it's now been over a year, but we've asked every single guest that's ever been on Angry Americans. There are 3 colors of Peeps that I present here: yellow, pink, and blue. Kristen, which color would you choose and why?
There is only one color of Peeps, and that is blue, because blue is the most delicious. Hello, that is the why.
Totally unexpected. That if I were going to rank which one you were going to choose, I would have thought that would have been last. So I love the surprise that is a part of every conversation. And finally, I have another gift for you that I'll get to you at some point. We do an American whiskey each time. And I've been on a kick ever since Jeffrey Wright joined us on his show. This is his whiskey, Uncle Nearest, but it's a small batch special from 1884. And I'll get that to you to make a Manhattan or whatever it is you like. But you are a true American inspiration. You are everything that this country is all about. I've been honored to have you as a friend. I am so grateful for what you've done for my mom, my wife, every mom out there, and just for our country. I think you're such an important leader, and I've really been humbled to have you as a friend. So I just want to thank you for all the work that you do, especially right now. I want to wish you a happy Mother's Day, and just thank you so much for joining us here on the show.
Well, thank you, Paul. Thank you for your leadership. Thank you for lifting our nation. Thank you for showing true patriotism, which is making sure our country actually moves toward our ideals instead of away from them, which is right now. Thank you for being angry and staying angry, and thank you for getting the word out.
You got it. And now I'll let you go back to the hail and the murder bees and the dog. Is the dog still there?
The dog is here.
Okay.
She is pretty much under the table right now,
all right,
scouring because of the hail, and then there was some thunder. I didn't even note this to your guests. They may have heard it. There was some thunder, there was lightning, all the things happened during.
You have all the forces of nature rallying around your leadership. Thank you so much for having us. Happy Mother's Day, and stay frosty. Thank you.